I am Emma Brackett. I'm the Director of Outpatient Substance Use Disorder Services at St. Lawrence Health Systems. I am here with my colleagues, Emily Marquardt and Elizabeth Stiles, and we're going to talk today about the impact of COVID-19 on substance use. So what we'll be going through is, first of all, the general impact. We'll be showing some statistics. We'll be talking about COVID-19 as trauma, how we have integrated trauma-informed care. We'll be touching on healing and resiliency. Our services offered. We have in their own words, so some of the experiences of our patients or people in recovery, changes and challenges in service delivery. We'll be looking as well at some of the warning signs of addiction. What we've noticed is that it's definitely increased since COVID-19. People who maybe wouldn't have a thought that they might encounter issues with addiction before are starting to see that. Building community, and then we'll end with some of our supports that we've added during COVID-19, including our emotional support line. So this chart is from Millennium Health, and they are the company we use to do our toxicology testing. And this is actually just a fraction of the picture here, but quite jarring if you look at the increase from March 13th, 2020, tracking 4 major drug groups: cocaine, fentanyl, heroin, and methamphetamine. So with fentanyl being the largest increase, and fentanyl unfortunately being one of the more potent drugs. So some of the impact of this is people not realizing fentanyl is mixed in with heroin, cocaine, or even methamphetamine sometimes, and a large increase in accidental overdose during this time. So nationally, all 4 drugs have significant increase in positivity since the declaration of COVID-19. So numbers wise, we're looking at 31.96 for non-prescribed fentanyl. So once again, the highest increase in the most potent drugs, which has had a really tragic impact. 19.96 increase for methamphetamine. Often that is homemade, causing a whole host of other issues. 10.6 increase for cocaine. Just going back to, with COVID-19, there's been a real decrease in agencies that might have done home visits before, might have been checking in on people. So we've seen a big increase in domestic violence and just dysfunction in the home, use in the home. And then, of course, heroin, also a 12.53 increase. Now, we believe that these numbers are actually greatly underrepresented. So these are just the people who got tested during that time period. But many services either switched completely to telemed during this time, or a hybrid as we did. And even if they were having people come in person, they weren't always necessarily testing them every time. Probation, parole, child protective services, they all greatly reduced or even stopped testing. So these are just the people that got tested. Some more sobering statistics. It was reported by Kapu Health that the number of opioid overdoses in large cities has risen by 54% in 16 different states. Pretty much anywhere you go across the country, they're reporting spikes in drug overdose deaths, with over 30 states reporting increase in opioid involved overdose. So primarily, like we said, the illicit fentanyl is really taken off in a very tragic way. And let's not forget about alcohol. Alcohol sales have increased by more than 25%. I remember when we were talking about essential businesses and some people questioning why liquor stores were made to stay, were okay to stay open. But the reality is that many of our patients depended on alcohol, that for them to stop would be a life-threatening thing. So it really was an essential thing to keep open. So when we look just at St. Lawrence County, we have, of course, also seen the same trend of an increase. So 3 intentional overdoses on substances in 2020 since the pandemic. 2 of them were very young people under 21 years old. In that same year, 2020, we had at least 11 accidental overdoses with combination drugs. 10 of them included fentanyl. We have 8 more deaths that are pending toxicology and autopsy, but could very well add to these numbers. And already in 2021, we've had 2 deaths that are potential overdoses. We're still awaiting results. So St. Lawrence County was definitely hit in a lot of the same ways that we've seen across the country. So a couple of things that may be adding to this impact, specifically to substance use, is that these lockdowns and travel restrictions have disrupted drug supply and transport. So in some ways, we may think initially that that's a great thing, we're cutting off the supply, but for people dependent on these substances that are suddenly spiraling into withdrawal, we did, remain open with our detox services, but there were certainly changes there. And so not only are they experiencing withdrawal, but they might turn to alternative substances if they can't get the one that they like, going into some really dangerous combinations or some really desperate measures in order to get that high. There also might be turning to unfamiliar dealers, people they don't know, that they don't trust, and those people may have varying potencies, combinations of drugs. That's where we see a lot of the fentanyl lacing of the drugs. We also saw increased isolation. So people are not using anymore, with a lot of people around them. They may be using all alone. So there's no one there to check on them, no people to check in with, no one to intervene during an overdose. So if no one is conscious to administer the Narcan, then it's not useful at that time. And then just psychologically, the isolation, disconnection from recovery supports. Many of our people cited boredom, job stress, job loss, stress. These are all things that can really derail recovery efforts. Okay, so when we look at COVID-19 as a whole, I think what we're finding is that it really provides a lot of the preconditions for trauma to occur, or collective trauma, as Bessel van der Kolk calls it. And some of the factors that we've seen are the lack of predictability. Unfortunately, we're kind of still in that state where there's a lot of unknowns. Each day you might get new information, different information, varying information, and we're really not quite sure exactly what's going to happen next. Immobility. So people are isolated, restricted. Some of the people that are quarantined or in isolation literally, can't leave their house. We are all experiencing a loss of that human connection. Even just simply the lack of human touch, hugging, having that skin to skin contact can be so healthy and necessary for human development. We're noticing that people are coping by numbing out and spacing out. So it's too much, it's too overwhelming. We can't take it all in. So people may turn to substances or increase their substance use, or just not be able to deal with that because it's just too much. A loss of sense of time and sequence. I think we can all relate to not knowing what day it was or even what month it is. So having this experience for a prolonged time can really lead to a traumatic outcome. That sense of, is this ever going to end? And not really being able to ground yourself. Loss of safety. So, things that used to be safe are no longer safe. And a loss of sense of purpose. So for a lot of people, they may have lost their job, they may have lost family members, friends, and start to really question things that made sense to them before. So it's really kind of bringing on a new perspective for us. I would say the one positive thing about collective trauma is that it also leaves for an opportunity for collective healing. Oasis put out a big campaign called Alone Together, kind of helping people recognize that we are in this together, even if we have to be physically apart. So what we really have always strived to do, but became especially crucial during this time, is providing trauma-informed care. So trauma-informed can be an awareness of the human experience, its impact on individuals, families, and communities. It means we're curious about why and how people respond. So we're not degrading or shaming. Instead, when we see another's response that may seem strange or destructive, we can be curious rather than judgmental. Another quote about trauma-informed care says, anything that is wrong with you began as a survival mechanism in childhood. So a lot of what we see when people respond to an incredible amount of stress is a regression into some of those behaviors that they may be engaged in when they were younger. So going along with trauma-informed care is this concept of resiliency. So how we navigate a crisis or traumatic event depends in large part on our individual resiliency and collective. So this ability to recover from difficult experiences and setbacks, to adapt, move forward, and sometimes even experience growth. So one of the most significant determinants of resiliency is the quality of our close personal relationships, especially with our parents and primary caregivers. So when we can look at somebody's early attachments, we can often predict or it greatly influence how they may play out relationships or their resiliency throughout their life. So it plays a lifelong role in human adaptation. So clearly, COVID-19, families, children, parents, this has all had a significant impact. And lots of people, may have been separated from their close contacts. So normally in a traumatic situation, we would kind of spend more time with the people we love and care about us and be able to have those close personal interactions, which hasn't always been possible with COVID-19. So I'd like to talk a little bit about how trauma affects us differently at different ages. Most critical changes are typically seen in the first 20 years. So this is a little small. I'm not going to read everything on here, but we have a lot of questions typically about, how is this going to impact children later in life? And with a lot of parents becoming remote teachers in addition to parents and just trying to keep everything together, meanwhile dealing with their own stress. So what we know about different parts of the brain and different ages when they're most sensitive can help us to support our children in learning and growth. So depending on their age, they may be more sensitive to language and touch, to visual processing. So going back to language and touch. So these are our birth to 6 years. They do require that physical contact. Visual processing, this may be giving them pleasant things to look at, giving them outdoor time, developing their vision. Balance and coordination with the very young children under a year. This is really important. Playgrounds and swimming pools, a lot of them have been closed for a long time, but finding ways to engage them physically and creatively. Brainstem, so breathing, heart rate, and temperature, trying to help your child self-regulate is going to help build their resiliency and development. Hearing, learning, and emotions, once again, 0 to 6. So talking, singing, allowing pleasant sounds. And then we get into judgment, 12 to 22 years, choices. So this is, when we talk about how hard it's been for teenagers, college students, and their lack of choices and decisions that they've been able to make this year, and how hard it's been on them for that. And then Lastly, the frontal lobe or concrete thinking, this is 3 to 12 years. So this is the ability to problem solve, to stick with things even when you're frustrated, and how important that can be when you're that age. So some of the major factors of resiliency also really align with the active ingredients of recovery. So things like having a positive but realistic outlook. We sometimes call in a phrase we use people in early recovery that may be positive but not so realistic. We call it the rose-colored glasses sometimes. Having a moral compass, so having values that guide your behaviors, that motivate you, belief in something greater than themselves, whether that be God or as something, a higher power, some sense of spirituality, altruistic concern for others, so wanting to be helpful, social support, acceptance, and then mission, meaning, and purpose. So we thought it was important to include these and the parallels of recovery, because what we've seen is actually some people with substance use disorder have actually fared better, much better than expected during COVID-19. And we believe because the things that they've already worked so hard on to build a foundation in recovery are what we look at as post-traumatic growth. So because they've endured some hardships in the past and gotten through it, they're actually better able to handle some of the stress now. For example, isolation, it's been really hard for some people. Some of the patients we work with have been in solitary confinement or locked down. A lot of our patients have been locked up. So they've had these experiences that have helped in some ways better prepare them for this situation than maybe people not in recovery. So a little bit more about resiliency. Resilient people learn to carefully accept what they cannot change about a situation and ask themselves what they can change. That's Dr. Southwick talking about it, which is a great parallel to the serenity prayer, which pretty much in any recovery program or AA meeting or NA meeting, you'll probably hear, and it goes, God, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. Another kind of piece that goes along with resiliency are what we call self capacities. So there are 3 factors that bolster resiliency. Number 1 is feeling connected to caring others when they are not present. So our interconnection. So this has been really important in COVID-19. We've helped people with this in many ways. And what's interesting about the neuroscience is that our brain actually doesn't know the difference between someone physically being right next to you or if you practice imagining that person there. So we can actually cultivate that connection without the physical component. The second self-capacity is feeling deserving of life, love, and attachment. So feeling worthy. That's something, people with substance use disorder often deal with a lot of feelings of guilt and shame. Do I even deserve recovery? Do I even deserve another chance? Done so many things I'm not proud of in my life. And then managing seemingly intolerable feelings. So basically managing those day-to-day frustrations, grief, loneliness, all throughout COVID-19. So the more we can bolster these self-capacities, the less people will depend on extreme behaviors to cope. So we wanted to include some of the strategies that we use in treatment to help increase self-capacities. And I just kind of want to point out too, it's been a really interesting parallel that as caregivers, as therapists, as clinicians, we are often right. COVID-19 has kind of put us a little bit right alongside our patients, and that we're really having to use a lot of the things we preach just to get by ourselves. So this is not limited to just people with substance use disorders. Any of this can really apply to all of us. So fostering that interconnection, it may simply be having pictures of loved ones and looking at them to help get a visual. Use of transitional objects. So for some people that might be, the necklace your grandmother gave you, or a stone that reminds you of the ocean, or anything that can kind of bring up other associations or pleasant memories. It might be, that personal connection with your therapist or your provider. So actually being authentic and telling a client that you're thinking about them, that this is difficult, really acknowledging that. It may be writing a note or creating something together, making a tape for someone that they can play, if they can hear your voice, they can remember that interaction. Might be writing a list of people who care about the client. So some of the strategies to help with that kind of sense of self-worth and worthiness is creating opportunities to participate in activities that they enjoy, that they do well. So for a lot of our people, they did end up being out of work, and even volunteer opportunities were limited, but there were still things they could do, like maybe going down the street and shoveling their neighbor's driveway. So we really tried to balance out safety with opportunities to engage in activities. So lots of praise, lots of positive reinforcement. Sometimes I would have a patient that said, all I did today was got up and showered. Well, that's amazing, right? There's some days where that really does need to be celebrated. It might mean goal setting. So trying to balance out affirming comments for self-limiting ones. Getting them to get involved in helping others in whatever creative way that means. And then also a big piece is for some people, lucky enough to have this be the most traumatic thing they've experienced, but most people have experienced pretty tough stuff prior to COVID-19, and reminding people that they lived through that, they survived that, and even reflecting on how did they get through that and how can we take those strategies and apply them to what they're going through now. So a few more strategies. These have to do with that feeling management, that kind of day-to-day self-regulation. So we want to actually teach the vocabulary. So this goes for children too. Learning feeling words, learning about the sensations in your body and making those connections. So that rapid heart rate, maybe that is anxiety, maybe that is fear, and let's talk about it. Teaching the client that feelings are different from actions. Anger doesn't always have to result in punching the wall, right? Those are two separate things. For emotion regulation, and trauma, it's really helpful to get the 5 senses involved. So making sensory objects and using activities that really light up the centers in our brain of touch, hearing, seeing, smelling, tasting, chewing. And even though we might not be able to do so much person to person, animals have played a huge role in healing through COVID-19. Continually working on strategies to make strong feelings more tolerable. So ways to kind of reduce that intensity. Had several people talk about how they rearranged rooms or made their garage into chill room, sensory kit, calm down. So any kind of little changes can make a huge impact. And then the last thing I want to mention is just a specific intervention called dialectical behavioral skills, which was originally designed for personality disorders. But what we found is that it's very effective in substance use, in mental health, and can also be applied to COVID-19. So I'm going to turn this presentation over to my colleague, Emily Marquardt.
Hello, I'm Emily Marquardt. I'm the Inpatient Director for Substance Use Disorder Services. So I'm going to continue talking about COVID-19 and the impact the pandemic has had on our programs. So looking at addiction, we really, as we look at treating individuals, we want to look at the purpose and how they're serving them, because they're all meeting a need in some way. So according to one of our leading experts in the addiction field, Gabor Mate, all addictions, whether drugs or to non-drug behaviors, share the same brain circuits and brain chemicals. On the biochemical level, the purpose of all addictions is to create an altered physiological state in the brain. This can be achieved in many ways, drug taking being the most direct. So an addiction is never purely psychological. All addictions have a biological dimension. So when we think about addiction, it is impossible to understand it without asking what relief the individual with addiction finds or hope to find in the drug or the addictive behavior. So at St. Lawrence Health System, we really seek to find every client's unique purpose in maintaining their addiction, again, whether it's through substances or behaviors, so we can effectively treat them and work with them to replace those behaviors with healthier options. So looking at the brain, just to continue on from what Emma had shared, we want to look at the behavioral component and also the pharmacological component when we look at treatment options. So from a counseling perspective, counseling targets the cortex to help treat the psychological aspects of dependence. And the cortex is possible for decision-making, thinking, reasoning, planning, so that executive function, and that's in the front part of the brain, the cortex. And then we look at the medication side. The medication targets the limbic region to help treat the physical effects of dependence. So the limbic region is responsible for basic drives or urges, rewards, and pleasures. So all those feel-good emotions. So possible benefits of combined treatment approach. So when one modality alone is not sufficient, we really want to look at both medication and psychotherapy as treatment options for our clients. So some possible goals of combining behavioral and pharmacological treatment are to quickly bring the patient into a state of remission from the illness, reduce the possibility of delay in a state of remission from the illness. So the goals of combining behavioral and pharmacological treatment are quickly bring the patient into a state of remission from the illness, reduce the probability of delay in initiating treatment or eliminate relapse or reoccurrence, treat both the symptoms of the patient and reduce possible stress on family, enhance adherence with medication, enhance psychosocial skills that were lost or never learned due to the psychopathology or addiction, teach the patient and the family methods to cope with residual symptoms, and potentially accelerate the psychotherapeutic process and prevent relapse. So at St. Lawrence Health System, we offer many behavioral health services. So we're going to go through each of these and talk briefly about what these services look like. So we have our inpatient detox service, which is at Governor Hospital. And that typically is a 3 to 7 day hospitalization for persons experiencing physical withdrawal, and that can be from any substance. We have our inpatient rehabilitation unit, which is at Canton Potsdam Hospital, and that's a 28-day programming with 24/7 monitoring for nurses, counselors. We have physicians, psychiatrists, with daily counseling, group therapy, and other programming throughout the day. We have our outpatient services, which are at Canton Potsdam Hospital and also Governor Hospital. Our outpatient services offer one-to-one counseling, evaluation, intensive and non-intensive programming, and also group therapy. We have our family services within that outpatient setting, which is either with or without the significant other. We have our maternal wraparound program, which Liz Stiles will be speaking about briefly. And then our outpatient mental health counseling and primary care and medical services.
Hi, my name is Elizabeth Stiles. I oversee the maternal wraparound program here for the St. Lawrence Health System. So the maternal wraparound program aims to help women with opioid use disorder. We work specifically with pregnant and postpartum women up to 12 months after their birth event. We really work to positively impact the families in the North Country. We have patients all across St. Lawrence County and even a few from Franklin County at this point. We do a lot of case management and linking women to basically any type of barrier to care that they may have impacting them in their recovery. Some of our main goals for the maternal wraparound program are promoting maternal health, improving birth outcomes, reducing risks and adverse consequences of prenatal substance exposure. We want to increase the number of pregnant women that are actually identified with substance use disorder during their pregnancy. Improve communication amongst providers. So we really work very hard to make sure that primary care, OB, the SUD providers, and whoever else, whatever other community resources are involved are updated and are aware of what's going on with that patient specifically. And also another goal would be to increase the percentage of babies that go home with their mother. So some common risk factors for the women that are enrolled in our program specifically are poor nutrition, poverty, domestic violence, co-occurring mental health conditions, specifically depression, history of trauma, PTSD, and anxiety, legal involvement, lack or inadequate OBGYN and primary care, limited or no education about neonatal abstinence syndrome or NAS prior to the birth event, and limited parenting knowledge. Some of the education that we work with the MRAP patients to go over throughout their pregnancy and after include things like medication safety, how to safely maintain their medication away from their children, maintaining the recovery from addiction throughout their pregnancy, which can be difficult. Sometimes that does require some dose changes if they're on MAT. Hospital and delivery education includes birth plans, NAS education, Eat, Sleep, Console, which is the screening process that our hospital does with each baby that has been born exposed to substances. And then we also establish a plan of safe care, which is a New York State document that is shared with the birthing hospital and basically is a document that lists all of the strengths and any education we've done, if we've assessed their home for safety, if they have all of the things that they need for that baby, and then also any of their strengths related to family, friends, people that, you know, could be a potential support if needed. Breastfeeding education, taking the baby home. So we do a lot of education about which baby items that they may need if they need to establish with a new pediatrician. Taking care of yourself postpartum. We do depression screenings, safe sleep, shaken baby syndrome, overcoming stigma and shame. So we do a lot of education with the women in our program about what stigma is, where they may encounter it, how to cope with it. If it's motivating them to make a phone call or write a letter, we also will help them with that. We're very passionate about making sure that these women are treated just like every other pregnant woman. How to communicate with medical professionals and how to respond to being treated differently or with disrespect. So a few changes that we've had to deal with as far as our delivery of services goes are we've really increased the contact with the higher risk patients in our program. We've had a lot of domestic violence issues since COVID has started. We've also had an increase in CPS reporting. We began porch drop visits, which porch drop visits are where we basically will go see the woman at their house, and when it's nicer weather, we will sit outside with them, check in, assess safety, if they need diapers, formula, bottles, anything, basically, we will make sure that they get that. Modality of visits. So it has been difficult to build a rapport with a brand new maternal wraparound patient as compared to when we were able to meet them physically in the referring agency or even in our office. So we have been doing video chatting, phone calls, the porch drop-offs, and also we utilize a lot of online evidence-based education.
So I'm going to talk a little bit about social determinants of health and how those have really created greater vulnerability for a lot of our patients. So according to Harvard Health Publishing, people who suffer from the disease of addiction are particularly vulnerable to both contracting the coronavirus and having a more severe disease when they do contract it. There are many reasons for this, but they boil down to something called social determinants of health, which according to the Centers for Disease Control and Prevention are conditions in the places where we live, learn, work, and play, which affect a wide range of health risks and outcomes. So people suffering from addiction are vastly more vulnerable to coronavirus. As research indicates, these individuals are more likely to be homeless, lower socioeconomic status, smokers with lung or cardiovascular disease, under or uninsured, or have experienced serious health and socioeconomic issues stemming from drug addiction. There are also millions of vulnerable incarcerated individuals, many of whom are incarcerated due to their addiction and related nonviolent drug offenses. When we look at this pandemic, we really have seen a pandemic within a pandemic. And Tim Ryan, who's actually a recovering heroin addict, founder of the Man in Recovery and author of the book Dope to Hope, has reflected on this escalating struggle for individuals with addiction during this pandemic. So to quote Tim, he says, "What COVID has unfortunately done is fueled another pandemic within a pandemic, because you have different people who have the people that might have been in recovery, early recovery, or even long-term, that were used to going to 12-step based meetings or Christian fellowship or smart recovery. Now they have all these fears, such as I might not have a job. I don't know if I can pay my rent, or I'm losing my job. What am I going to do?" Relapses have been through the roof. Then you've had a lot of people who have mental health issues that can't get the help they need, or it has fueled underlying mental health issues that people might have been able to mask. You also have people that are drinking more. Alcohol sales are up, as Emma noted. So people need purpose and connection. And as he goes on to state, and without that, they get into their own minds. You take the person in early recovery and now they can't go get a 6-month sobriety coin or go celebrate that year sober. They say, well, you know what, maybe I can have a drink, or maybe I can smoke a little, I can't sleep. Let me call my doctor, get a soma. So they're really turning to other things to help them get through this time. And as he states, it's like opening Pandora's box. Mental health phone calls and suicides are all up. So looking at the impact of stress during the pandemic, we thought it was really interesting to note Gabor Mate in his quote from the research literature that has identified 3 factors that universally lead to stress: uncertainty, the lack of information, and the loss of control. And I think when we, reflect on what this pandemic has been like for all of us, not just our patients, it really kind of defines those 3 factors. So at St. Lawrence Health System, our SUD treatment providers and counselors have seen these 3 factors have a consistent presence for our clients during the pandemic. And we have seen the impact on their mental health and substance use disorders. For most clients, there's been a clear shift in their goals and objectives in treatment. The focus has shifted to how they're going to get their daily needs met, and in doing so without relapsing. So when we look to kind of getting back down to the basics, we really think of the HALT theory, which is very common in addiction. So HALT is a common used acronym by the 12-step circles in discussions of triggers in relapse prevention. It is based largely on the content of 4 chapters from the Alcoholics Anonymous publication, Living Sober. So to halt means to stop abruptly. The acronym for HALT, as many people in recovery know, means hungry, angry, lonely, and tired. For individuals struggling with addiction, this word is how they monitor their state of physical and mental well-being. Paying attention to whether you are hungry, angry, lonely, or tired is extremely useful to make the most of, especially when you're in new recovery. Newly recovering people in addiction and alcoholics are experiencing a new way of life, which is really challenging, and they're learning how to adapt to being clean and sober, which is a drastic change. The acronym HALT helps individuals in recovery to remember to take care of themselves. However, throughout the pandemic, this has been a challenging goal given the increased stressors and unknowns of the pandemic. So changes and challenges, as both Emma and Liz have noted, within our service delivery. Just to recap, access to care, COVID protocols, which has changed many times throughout the last year, emergence in telemedicine services, testing and vaccination implications, staffing changes and shortages, and limited family, friends, and visitors. So I'll talk a little bit more in depth about how each level of care has been impacted. So at the outpatient SUD level, many counseling services needed to shift from in-person to telemedicine. This includes one-to-one counseling, group therapy, and intensive outpatient program. Some patients have difficulty accessing telemedicine. The therapeutic dynamic can be impacted by staff's presentation with all the wonderful PPE protocol we have, including face masks and face shields, and at times other PPE, which as therapists has really impacted, that use of body language and how we connect with our patients. Also patients are required to wear a mask while in treatment, except for times when, they're not in a private room. So looking at telemedicine specifically, there are some challenges, but then also thankfully some benefits. So first off, to look at the challenges, as I noted, body language can be difficult to assess and display, and that can really impact personal connection. So body language can often be quite telling and give the counselor or physician a clearer picture of the client's feelings, thoughts, moods, and behaviors. Telemedicine appointments can lack that intimacy and intricacy that real-world interactions possess. It can be difficult to respond quickly and effectively when a crisis happens. Online treatment adds a layer of complexity with regards to privacy and unreliable technology. Group therapy is challenging and is difficult to foster the therapeutic environment and mutual support provided by the group therapy participants. And the scope of online therapy can be limited, so it's typically not effective with more complex cases. Some of the advantages to telemedicine: treatment can be more accessible, especially in rural settings with travel, which is difficult in winter months. Convenience, since clients will be attending therapy sessions online, typically in the comfort of their own home, they can often schedule sessions for times that are most convenient for them. Oftentimes this allows them to save time, which they would normally be spent commuting to and from appointments. It can eliminate fears of running into others in the waiting area and possibly reduce that stigma, and potentially feeling more comfortable in a familiar setting, which could enhance vulnerability and disclosure. So some of the changes to the delivery at our inpatient rehabilitation setting: patients are all required to wear a mask during treatments, except when they're in a personal room. Social distancing must be practiced at all times, which does impact our ability to organize group therapy and other activities that we would normally have on the unit. Patients are not able to have visits or in-person sessions with family or other loved ones during treatment, so we've moved to telemedicine for those. All self-help meetings with community volunteers have been suspended, so patients can either facilitate their own self-help meetings in-house or participate in online meetings. Ongoing treatment options have been limited at times, greatly impacting patients' ability to access the care they need to continue with their recovery efforts after rehab. And again, just to note, the therapeutic dynamic can be impacted by the PPE protocols that we all need to follow. And to note changes for the delivery of services at the inpatient detoxification setting. All of our patients are COVID tested prior to admission. Patients are expected to wear a mask during treatment. They are not permitted to leave their rooms during the course of their treatment. Group therapy has been suspended, therefore there has been a reduction in programming throughout the day. So again, we've tried to really implement telemedicine whenever possible to encourage engagement in treatment just in a different way. Again, ongoing treatment options have been limited at times, which impacts aftercare options for our patients. And again, the therapeutic dynamic can be impacted by PPE. I think it's really important, despite all of these changes, that throughout the pandemic, for all of our levels of care within behavioral health services, we've remained open, and there's been someone on site each day to be available for crisis situations or our high-risk patients. And we are really proud that we've been able to continue to maintain that continuity of care for our clients. So experts in the field of addiction reflecting on the impact of the COVID pandemic, So Shatterproof is a national nonprofit dedicated to reversing the addiction crisis in the United States. Shatterproof quotes, "A loved one failing ill, kids unexpectedly out of school with no childcare, coping with physical distancing, daily routines interrupted, life milestones canceled, adjusting to working from home or worse, not being able to work at all. These are the crises we are all facing as the COVID-19 pandemic continues." So SAMHSA, the Substance Abuse and Mental Health Administration, goes on to state, the latest SAMHSA report examining substance use and addiction trends by industry showed that individuals in the accommodations and food services industry had both the highest illegal drug use in the past month and the highest rate of substance use disorder in the past year. So that's interesting for us to note. So implications for children and families. According to the National Institute on Drug Abuse, the COVID-19 response has resulted in school cancellations for nearly 30 million children. For those that rely on school lunches, this means food insecurity. For others, this may mean being quarantined with a potential abuser, while others are missing milestone events like graduations, proms, and instead facing boredom or increased screen time. So decades of research shows that there's both risk and protective factors for drug use. For example, lack of parental supervision, drug availability, and poverty are risk factors, while parental monitoring, academic competence, and strong neighborhood attachment are protective factors. So it's highly concerning that the COVID-19 response could tip the scale, increasing risk factors for many of our American youth. What's more, our families were not anticipating the need to monitor school-age children around the clock, and the increased free time may increase drug experimentation. Childhood trauma is linked with future substance use disorders and other negative mental health effects. COVID-19 may increase exposure to potentially traumatic childhood experiences like harassment, abuse, loss, disasters, and other traumas, which can be caused when children or their families experience single or multiple medical events, which we've seen so much of in St. Lawrence County and around the world. So looking at physical signs of addiction, either within yourself or with family and loved ones, overactive or underactive, depending on the drug, repetitive speech patterns, dilated pupils, red eyes, excessive sniffing or runny nose, not attributable to a cold, looking pale or undernourished, clothes that do not fit the same, weight loss, change in eating habits, or unusual odors or body odor due to lack of personal hygiene. Some of the behavioral signs of addiction: missing work or school, work-school problems, missing important engagements, isolating, secretive about activities, disrupted sleep patterns, legal problems, relationship or marital problems, financial problems, conversations dominated by using or drug alcohol related topics. And then the emotional signs of addiction: irritability or argumentative, defensiveness, inability to deal with stress, loss of interest in activities, people that used to be a part of their lives, obnoxious behavior, silly, confused easily, denial, rationalizing, so offer excuses, justifications, or other explanations for their behavior, minimization, admitting superficially to the problem, but not admitting to the seriousness or full scope of the behavior or consequences, blaming, placing the blame for the behavior on someone else or some event, or diversion, changing the subject to avoid discussing the topic. So ways to help. So Cedar Sinai Medical Center had some great recommendations. Check on your loved ones. So, even though you might not be able to check on them physically, making phone calls, sending emails, letters, staying in touch with them however possible, to make sure you know how they're doing. And I think the important piece is really letting them know that you're there for them and care for them, even though you might not be able to see each other as much as you normally do. So offering support without judgment. So obviously we want to avoid shaming your loved one, instead of, obviously criticizing, offering unconditional love and support, and encouraging them to potentially get help if that's what they need. Your loved one might be afraid or embarrassed to talk about it with you. So when appropriate, one of the best things you can do is ask how you can best support them. And that really opens the door for them to share how you can help them. And seek out help. So you can't control others' behavior, but you can point them in the right direction. So potentially starting with their primary care provider or health insurance provider. You can search online. There are lots of different resources. It's important to ask the programs what types of treatments are available, insurance, and staying persistent is key. So continue on. Really, this is all, a call for community and support for one another. So again, to reference Cedar Sinai Medical Center, addiction is common, it's treatable, and it's a chronic disease. It's not anyone's fault. The underlying factors that contribute to addiction are all amplified right now by COVID-19. Anxiety and stress can be even more triggering for those with mental health conditions who turn to substances as a way to cope. At a personal level, we must be vigilant to the struggles of those around us: mental, physical, emotional, economic. Everyone is struggling in their own way, but we certainly are not struggling alone. So again, checking in on your friends, family, coworkers, and neighbors. We all must work harder to build community in this time than ever before. So the last piece is really just offering hope, which is our motto for behavioral health services. So we do have the St. Lawrence Health System emotional support line available for anyone, whether it's staff, community members, or patients. So it's staffed by licensed mental health professionals from our system and available 24 hours a day to assist in talking with anxiety, fear, virus exposure events, trauma, first aid, depression, basically however we can help, we will do that. So that can also connect to individual counseling, whether it's virtual or in person, our care team group debriefings to address trauma, self-care education, self-care appreciation bags, and assessment and referral to higher levels of care.
Thank you so much. We hope you learned some helpful information that can help you or others cope with the COVID-19 pandemic. And please reach out to us if you have any questions or would like to connect to services. Thank you.
Thank you.